The American Adoption Congress 13th International Conference, April 11th to the 14th, 1991 in Garden Grove, California. This is program number D151, tape 16.
We might have a few late folks coming in, but we want to stick to their time schedule. For those of you, just to make sure you have the right spot, this is the session on adoptive families in crisis. So I guess it was kind of tricky out there to find which rooms. So at any rate, this is the session on adoptive families in crisis. The three of us are very grateful to be able to have this opportunity to present. The Adoptive Congress is such an arena for airing concerns, for promoting change, for touching vital nerves. It's just a very nice feeling for all of us to have this opportunity to be here, and we want you to know that. It's beneficial. Well, first, as I begin, allow me to introduce, to my right is Helen Gallagher. Many of you probably know Helen. She has been very active in the reform movement for how many years?
Seems like forever.
Oh,
for about 10 years.
Helen is an adoptive parent and has raised 4 children. She's also a search consultant and director of family ties in Eugene, Oregon. To my left is Carol Green, my associate, and she and I are co-directors of adoption counseling and consulting services, and we're both clinical social workers in private practice. And it has been our association with the Congress that really has prompted us to develop this specialized service in our private practice. So we're grateful to the Congress, I guess, from that perspective as well. As I introduce ourselves, what I would like to do also, though, is to touch base with you folks and get an idea of whom we have represented. How many here are adoptive parents? Great. How many here are adoptees? And how many are birth parents? Okay. How many are raising teens? Or have raised teens, and you're here to tell about it, huh? That's great. Is anyone here that is an organizer for the conference or has done work with it? You have a host tag on. Special thanks to you folks. I don't know if any of you have ever put on conferences before, but it's a lot of hard work. So we really want to acknowledge you folks and what you have done to make this possible. Our focus today is on the adoptive teen. We will be looking at this from the perspective of the teen that was adopted as an infant as well as adopted as an older child. We'll be looking at this from the family system's perspective. We'll be looking at this from a perspective of the there and the then to the here and the now. The there and the then, roughly 20 or so years ago, as to what was happening in the field versus what's happening in the here and the now. How much we have learned, how far we have come. We'll be highlighting, I should ask too, are any of you in here therapists or oh, great. How could I forget that one? So we should have some great dialogue in here, because we want to examine this from the perspective of what the professionals and clinicians didn't know then, but fortunately what we're beginning to learn now, but still need to learn. We have a long way to go, but we do want to, add that clinical piece to this as well. Helen will begin by sharing her perspective over many years of raising her children. As you listen to Helen, I'm going to ask you, though, to be very active participants. Listen to what she is saying was it in the late 60s when you were raising your kids, to the context of the 60s and what we didn't know. And if Helen were raising her kids today, how different it could be, what she as a parent would know, what us professionals would know. So as Helen relates her story, do keep that in mind. Carol will be talking about the adoptive teen within the family context. She'll begin with emphasizing family systems theory and what we know about that perspective, and she will then incorporate the dynamics of the teen and with special emphasis on the adoptive teen, what is unique and what is the same. I'll conclude by focusing on the adoptive teen who was adopted as an older child with the consequent traumas and the consequent dynamics. And then at that point, it's your turn. We will hope to have a dialogue and some very good questioning going on. So at this point, I will ask Helen to begin.
Ready?
And remember to give her the little...
The little hootie.
Oh, yes. Thank you.
Well, I'll pass out. We made up some packets of information, since our experience has always been when we've gone to workshops, you get a certain amount that you can hear, and then other information you need to take in afterwards. So we'll be referring to some of the things in the packet, and if for some reason there's not enough packets to leave, you name a number, and then we'll send you a packet later.
Thank you, Carol. I'll just start right in.
Great, great.
Just remember, the rose still grows on the other side of the wall. A close friend of mine said as we were discussing adoption search techniques. Later I recalled how this apt quotation and thought how appropriately this remark could be applied to persons involved in the adoption triad. I was a fresh air baby of the 1920s, as my parents fled from Europe soon after World War I, as their homeland of Czechoslovakia was in state of political and economic upheaval. Soon after they settled in an ethnic neighborhood in Chicago, I arrived. However, because both of my parents were employed in factories, I was placed in a poorly operated, crowded nursery school. By the time I was 18 months old, I was so severely undernourished and suffering with the disease of rickets that I was unable to walk more than a few steps. Fortunately for me, the social welfare department stepped in with to benefit underprivileged children in the various ethnic daycare centers. With parental permission, a child could enjoy a brief reprieve of 6 weeks during the summer from the unhealthy city environment. Can you imagine the pandemonium in Chicago's huge Union Station, filled with groups of noisy children of all ages being supervised by the social workers as they confirmed each child's itinerary and destination before boarding the trains? My destination was a small town in southeastern Iowa with a foster family who already had a 7-year-old son and had requested a young female child. My foster parents promptly attended to my medical problems and later decided they would like to adopt me. Over the next few years, I was bounced back and forth between the two families, and as the animosity grew, resulting in my birth mother adamantly stating that my foster parents could raise me, but that she would never, never sign any adoption papers. In effect, mine was a left-handed adoption, with no legal paper trail, as my foster parents didn't want to admit to defeat. Nevertheless, they changed my surname to theirs. However, when I was married, I used my birth surname and still do use it on all legal papers. When I was 13 years old, my birth mother appeared at the front door. It was time for me to come home. Come home? What did she mean? This was my home. These were my parents. Well, the return trip and my short-lived, quote, visit in Chicago proved to be less than satisfactory to everyone involved at that particular time. However, as I matured, I attempted to balance out my relationship between the two families, but the animosity was too firmly embedded. In January 1945, I'm also giving away my age. Are you figuring? I married and expected to get pregnant soon afterward. Our number one priority was to have a family, and due to my childhood circumstances, the very last thing I wanted to do was an adoption. At first, when I failed to conceive, we weren't too concerned, but as the months went by, we became more and more anxious. We eagerly listened to and tried every possible suggestion for a successful pregnancy. We suffered through many, many hours, frustrating hours of various forms of, quote, fertility rites. Obtained special medication, agreed to testing, but with every painful monthly disappointment, I cried buckets of tears as the baby never physically materialized within my body. We finally resorted to surgery, after which we discovered I was physically unable to conceive. At this point, I was very bitter, and it seemed as though everybody was pregnant but me. It was clearly evident we'd never have a baby to hold or a child to nurture and raise. Eventually, after 9 years of fruitless results, expensive medical bills, negative tests, and my exploratory surgery, we were forced to accept the infertility. We then made the decision to adopt just as soon as possible, and even though my husband was still attending college at the University of Southern California. Meanwhile, we energetically directed our efforts toward adopting, and soon the private contact proved to be very promising. Arrangements moved along smoothly as we joyously prepared for our newcomer. But at the last minute, the actual baby never arrived. Another couple were the lucky recipients. This failure had a traumatic effect, and we were upset. But we felt that we handled our disappointment with the minimum of difficulty. However, we were really devastated after 2 more subsequent failures had extracted their emotional toll. At this point, we decided to adopt through an agency, as we agreed that we needed some kind of security because we felt we were unable to emotionally handle the trauma of any more failed attempts. We approached the agency with caution, but after several intimate interviews in which we obviously had passed the requirement test, we were accepted as prospective adoptive parents. We were ecstatic. My husband's graduation day from USC and arrival of our first adopted infant son were almost simultaneous, and from the same agency, 2 years later, another infant son. 3 years later, after my husband's business concern had transferred him to Central California, we adopted an infant daughter from another agency. And 3 more years later, we adopted another infant daughter through another agency. We've always felt that we were very fortunate to, quote, have our family of 2 boys and 2 girls, thanks to 4 birth mothers who signed relinquishment papers. To these 4 women, I am and always will be grateful. On each child's birthday, I offer up a silent prayer of thanks to their birth mother, wherever she is, that her child is alive and well, because I know that particular day holds very special meaning for her. We were proud of our international family with Italian, Hungarian, Greek, and Hispanic heritages represented, and we believed that the children grew up in a strong family structure during their early years. Parenthood is challenging and rewarding, and not always easy, but I staunchly maintain that, in addition to the average everyday growing up pains, an equivalent set of traumatic emotional experiences unique to adopted children can contribute to compounding an already complex situation. It was during the time span covering my children's early adolescence that the adoption issue really created an emotional disturbance. I discovered many years later that all of my children had discussed adoption-related issues among themselves on numerous occasions as they were growing up, but none of them ever brought the subject to our attention in the forthright manner my oldest son did. He was an alert, intelligent youngster who energetically participated in activities of his own choosing, with the tendency of a loner and never one to blindly follow the crowd. During early adolescence, he repeatedly questioned his heredity and origins, and I'm certain that subconsciously he felt a divided loyalty. On the conscious level, he consistently stated that we were his parents, yet because he was adopted, he considered himself illegitimate. No amount of conclusive proof could change his mind or alter his convictions, and it was very difficult for him to understand why his mother relinquished him. I'm convinced that the seeds of his emotional puzzlement were sown at that time, which in his late teens spouted forth in the form of highly explosive, traumatic, temperamental outbursts. This tantrum-like behavior, coupled with frustration, rejection, and rootlessness, produced some tremendously powerful upheavals within our family. Now I know that in order to get our attention and put his point across, he was frantically crying out for help by employing desperate measures. But at the time, I thought surely one of us must be mentally unbalanced. During these, quote, spells, the other children watched, wide-eyed and silent, as my husband and I attempted to cope with the situation, regain our composure, and retain our sanity as we tried to restore peace among the family members. He now has considerably more control over his emotions, and while he no longer experiences such highly charged urges, he still has an uneven temper and occasionally slips into a tirade complete with four-letter expletives when repeatedly pushed or rubbed the wrong way. As an adult, he has expressed a strong desire to know more about his heritage, particularly if he has experienced a period of depression when the deep-seated feelings of rootlessness and rejection rise to the surface and the nagging questions go unanswered. Our second child, in contrast, was nearly an opposite in personality. He was gregarious, a follower, and much more even-tempered. He seemed to complacently accept my husband and I as his parents, and if he had any concerns, he never mentioned them to us. I assume that after witnessing his older brother's, quote, antics, he decided there was no need to add fuel to the fire at that particular time. However, as an adult, he has voiced a concern and wants to know more about his heritage, not only for himself, but for his children as well. Our third child, the oldest daughter, was a happy, good-natured, but sober child who appeared to be somewhat overwhelmed by her two older brothers. She wasn't a loner, but neither was she gregarious, but had one close friend and several good friends. She also never mentioned anything about her heritage during adolescence because she maintained that she suffered from middle childitis and was so busy trying to establish her place within the family structure, she just didn't have time to express any other concerns. As an adult, she too has declared a desire to know more about her heritage, particularly since she had a minor medical problem and was concerned about her health history, not only for herself, but for her children as well. Our fourth child was Hispanic and different from the very beginning, with dark hairs and eyes in contrast to the fair hair and complexion of the other three children. During her early years, she was a carefree, happy child, basking in all the attention that was showered upon her. She made friends easily, was high-spirited, and a follower. When we moved from California to Oregon, her self-esteem began to topple, and by the time she reached the 5th grade, it slid down and hit rock bottom. She struggled with the usual adolescent problems, but in addition to being adopted, she was raised in an alien culture, out of her ethnic realm, and all of these factors greatly compounded her situation. Also, being the baby of the family and wanting to be accepted, she was at a very vulnerable age, and with 3 older siblings to pattern from, she developed some very tricky behaviors that eventually led her into very serious trouble with the law, the juvenile authorities, the school officials, and with us, her adoptive parents. When she was in trouble with the law, part of the probationary period required family counseling. As I remember, these sessions were a complete disaster, with the children either giggling or acting self-conscious or staring at each other or at my husband and staring us down. The counselor or therapist was unsuccessful in getting any cooperation, and any advice or supportive suggestions were rebuffed, resulting in a mutual agreement that this type of counseling was not the solution to our problems. A few years later, I discovered also, during this congruent period of her life, All of my teenagers were experimenting with drugs and alcohol upon more than one occasion. During these restless, exasperating periods of time, I sensed there was something amiss within the family structure, but was unable to specifically identify the exact cause. By the time I was able to pinpoint, it was too late. Bad habits were well established and irretrievably ingrained. The deeply buried, sensitive feelings of rejection never surfaced as a pitiful cry for help drowned because it went unrecognized in the turmoil. In retrospect, I can see that the whole distressing situation didn't happen overnight, but it was a culmination of many factors that crept in, gradually ballooning until they exploded, spewing misconceptions and scattering accusations. While it was nobody's fault, everybody was suffering the blame. I firmly believe that the underlying theme was one of rootlessness and rejection. However, these feelings were never openly communicated verbally, but were conveyed through active body language. Also, they were subdued in the guise of not wanting to hurt anyone else's feelings any more than they'd been hurt already. I'm certain that during their teen years, my children were enduring the dilemma of coping with adolescence while simultaneously searching for the answer to the age-old question, who am I? Eventually, the adolescent years melted into the teen years, and as each child matured, the turbulence subsided to some degree. However, the final breaking point came with the demise of our 31-year marriage. Even though all of my children are grown, it appeared that many of the emotional scars are still present, and with the old wounds still tender, I felt that I must initiate the search for my children's birth parents in order to enhance further healing. In the meantime, the rose still grows on the other side of the wall.
Thank you, Helen.
Hi, I'm glad to be in sunny California. I'd like to dedicate today's workshop to Victoria, who sent us these lovely flowers, who's a friend and a birth mom, and I'd like to thank all the members of the Adoptive Triad who taught us and other mental health professionals about adoption issues. My belief is the same way that the Adult Children of Alcoholics movement have educated the mental health professional about addiction, the Adoptive Triad is doing the same thing with the mental health professional, to the mental health profession. As a family therapist from a typical community of 100,000 for the past 16 years, whether I see an individual, a couple, or family, I've always thought of them in terms of their family of origin. Just as Helen and her family didn't know as much about adoption issues back then, this has also been true of the therapeutic community. We used to wait until the right time to address adoption issues. How many of you have been in therapy and mentioned adoption and then it wasn't followed up until much later because there were a lot more important issues to address first? How many have been in family therapy or individual counseling and therapy and you told somebody you were adopted and nothing happens? Or how many? You know, I think things are beginning to change. One of the things that Susan and I noticed is that when we put ourselves out as adoption therapists, all of a sudden there's a lot more permission to address adoption issues head on and differently than when we just would say we were doing family therapy. It's made a big difference on all levels. Over the years, I've become eclectic in my approach to working with teens and their families. I use lots of different maps of types of therapies since each has advantages and disadvantages. Today, I'd like to talk about developmental stages, contextual family therapy, developmental affirmations for teens, as well as affirmations for parents. Then to talk some about issues to address in working with adolescents and their families. The maps are there for both parents and teens to remember the goal. The goal, if adolescence is successful, the teenager is capable of leaving home and living independently. This challenges the parents' capacity to allow and facilitate such a process. Another goal is for the adolescent to form successful, intimate relationships and to learn to use power legitimately rather than destructively or coercively. Adolescence is also the time for resolving issues around sexuality and aggression. The task is to create a family environment that provides the opportunity and the support to complete the adolescent growing up. The family needs to be a place for teenagers to share their questions and to share their pain. A child needs a place to be able to come home and say what happened, no matter what that is, and have a parent to hear and find resources to deal with it. One family that I'm working with, the intensity of the daughter's feelings are overwhelming to her adopted parents. Her adopted brother's temperament is much more low-key like the parents. How to help the parents realize that their daughter's temperament and response to her losses, her identity issues, expression of feelings was appropriate and normal. That I was much more concerned about her brother, who was much more in denial, more repressed, and less in touch with the reality. Parents have expectations, how they think it should be. Teenagers often have their own ideas and agendas. Family issues often come to a head during adolescence, as in Helen's family. Included in the packet is both individual and family developmental stages. When I see a family, I see each family member in terms of where they're at developmentally, where they're at in their grief cycle around their losses, where they're at emotionally is often different than where a person is chronologically. I tend to be a visual person, and I'll draw a continuation chart so other people know where each family member is at. And when people see that, when you see things in developmental stages, it's a way of being non-judgmental, non-blaming, and it's not pathology-oriented. It's necessary to frame the problem to all family members in terms of developmental stages and the adolescent's developmental tasks, delays, and interferences. Rigidity forms when a family member may be stuck. Oftentimes I see enmeshed adopted teens having difficulty leaving home. There's no permission to separate and be independent. A parent's unresolved infertility issues resurface around emancipation. If you look at the developmental chart for the family, children leave home 4 different ways. They need to complete a task, graduate high school, join the service. Children leave home and come back and stay away longer each time. The children or teenagers kick themselves out or get kicked out because of abuse issues, or with adopted teens because of separation issues, or they don't leave home and they stay little. Parents have 2 relationships. They have the relationship as co-parents, and they have the relationship as a couple. How adolescents perceive how their parents will be if they're not there often affects their adolescence. Because when you think about developmental stages, it's listed as the crisis of returning to the original marital pair. Oftentimes, couples aren't dealing with couple issues, and that gets camouflaged by how teenagers are acting. Both Suzanne and I use the clinical work of Dr. Ivan Naj. Dr. Naj grew up in Eastern Europe under Hitler and Stalin. Because of that, he developed contextual family therapy, which is much different than other kinds of family therapy systems. It's based on justice, fairness, trustworthiness, entitlement, destructive entitlement, invisible loyalties, and loyalty conflicts. These concepts apply to all members of the adoptive triad. Naj's work brings a sense of ethics of fairness into family therapy that is helpful to all family members. Suzanne will talk about invisible loyalties, and I'd like to talk about the concept of destructive entitlement. A person acts out in a way that is destructive to themselves and others and doesn't hold themselves accountable. It stems from how they were treated as a child. An adopted teen doesn't think it was fair that they were adopted. Because of attachment issues, they act out and feel entitled to act out and be more destructive. The more disruptions, the more a teenager keeps doing it because their reserve for trust was depleted. Adoptive teens need to be given credit for what they do give and when they do good things for themselves and others. There's a need to acknowledge current unfairness going on both adoptive parents and kids' sides, and not keep hanging on to the unfairness from the past. There is also unfairness when mothers are burdened and depleted, and fathers have to share the burden of giving and being present in the family system. Another way to reduce destructive entitlement. Adopted teens need to be told repeatedly and need to let in attachment and bonding affirmations. Another part of the handout package, there are affirmations. Positive reinforcing growth statements. These are all the things that we needed to hear growing up. These are the things that our kids need to hear. It's the lines that make a difference. What we say to ourselves and what we say to each other reinforce our own internal programming. There's affirmations for teens and there's affirmations for parents. As parents raising teens, especially adoptive teens, these can be the most trying years, and there are reminders that they need to hear. Some of the affirmations are, remember you could be a good parent and still make mistakes. Accept yourself. You can be you, have your own life, and still be a loving parent. You can learn the specific skills needed to raise a healthy child. You need your own adult time and space to renew yourself. Take it. Know if the parenting you received is influencing the parenting you are giving. The theory behind developmental affirmations is that issues recycle. Messages that apply to toddlers also apply to young teens. Both are at an exploratory stage. Oftentimes, adoptive teens need to hear affirmations from all stages. Teens need to be reminded that you're glad that they are there, that they're glad that you are glad that they're a boy or a girl. They don't have to act scary, sick, sad, or mad to get taken care of. They can let people know when they're angry. You're glad they're growing up. They don't need to suffer to get their needs met. It's okay to be responsible for their own needs, feelings, and behavior. You trust them to succeed and to make wise decisions for their own well-being. Oftentimes, I have two teenage boys. They act like they're shining me on, and then when I hear them talking to friends or in other situations, some of the stuff that I've said over the years, has sunk in. As raising parents of teens, it's important to keep planting the seeds. The results are there later, and these are the formative years. When adoptive families are in the midst of an adoptive crisis, it's hard to know what's going on. For teens that are adopted as infants, it's often the same adolescent issues, but to a much greater extent, such as the extremely low self-esteem with Helen's youngest daughter. Often their energy and differences from their adoptive family start standing out in startling ways. The more issues are addressed earlier on, the less turbulence adolescence. Adopted teens may grow up too quickly or not at all. In being forced to take roles, the adolescent does not learn to negotiate the proper balance of dependence, interdependence, or independence. Adoptive teens may have difficulty separating. They are often enmeshed. They often stay little. Adoptees may have some degree of separation anxiety and dependency conflicts. An adoptee's sense of having been an outsider in the family or the adoptee's fantasies may interfere with trusting and normal parent-child bonding. These conflicts tend to increase adolescent self-doubt, identity confusion, depression, anxiety, which in turn tend to be defended against by denial, rageful rebellion, and an attitude of stubborn entitlement. Adopted teens use drugs more readily, as in Helen's family, to deal with feelings, confusion, and stress. Adopted teens may have difficulty maintaining close personal bonds with other people. There are identity issues, lots of questions, who to talk to without betraying loyalty. Sexuality often gets acted out or assumed or not acknowledged. Emotions are painful, life is confusing and may be painful. Oftentimes outlets may be negative for their intense, immense physical and sexual energy. Family treatment issues that I address. What are the adoption issues? What are the other clinical issues? What is the chemical dependency or codependency history in the birth family, in the adoptive family? What are the bonding attachment issues using James's attachment scale? Where is the family in terms of denial, family secrets? What are the other parenting, marital, sibling, cultural issues? What is the history of separation? How flexible, rigid, resilient is this family system and its members? Ways that I found to work with teens include psychoeducation about adoption issues, providing realistic information about consequences. I talk to them like adults, At the same time, I also ask them how their little kids are doing as some level or degree of trust develops that I could do that. I give them a more realistic sense of time, increasing their personal awareness of their own personal responsibilities, reminding them of the goal, that their goal is to leave home successfully, focusing on personal change, improving their interpersonal emotional functioning, teaching them to recognize cues that their anger is coming. Could have been helpful with Helen's oldest son. I do role play, practical problem solving, modeling, assertiveness training, refusal skills. I remind them that their parents aren't perfect and everybody makes mistakes, including them, and how to learn lessons from it. Keep it simple, as teens tend to think in black or white. Since adolescence is hard and even the adolescent experts don't have all the answers, the task is to remember at the same time that the teen is separating from the adoptive parents. Their own separation issues are emerging or re-emerging. How to take into consideration the teenager's developmental tasks, delays, interferences. At the same time, parents are beginning to realize that children are leaving home. Being open to new maps or tools such as developmental affirmation or nauseous concepts may be helpful. Both teens and parents want the same thing, the adolescent to grow up successfully, become independent, and act in appropriate ways.
Okay. This little thing was made for a right-hander, and I'm left-handed, so there we go. Okay. The part I want to focus on now, as I mentioned earlier, is the older adoptee as a teenager, and I think I'll use the term teen in a broad concept that can probably begin as soon as 11. So we're looking at this from a broad framework. I think those of you in the field know that the number of older adoptees is increasing, that the emphasis within child welfare for permanency planning, that they are moving for termination of parental rights in great numbers, so that we are seeing more and more kids in the system that are there for the older adoptee. It's an area that is very disjointed. It's an area that we need to know much about, and that we need to dialogue and learn from each other. I've been working with these kinds of kids for 20 years, and they have taught me a tremendous amount. What these kids have been through, as many as you know, is tremendous. The extent of their abuse is hard for us to imagine. So yeah, these kids have taught me a tremendous amount, and much of what I will be sharing with you today is what I have put in perspective over these many years of working with these kids, because there are themes, there are patterns, and these are beginning to emerge for me. I've come to see these kids not just in the context of the physical abuse and the sexual abuse and the neglect which they have suffered, but this feels to be a very good group to mention this topic, and it's the area of separation trauma. And I think everyone in this room is vitally aware of what separation trauma does to one's life. And in my field, I wish we would begin to address this more, that I think we really are gaining tremendous knowledge in sexual abuse and physical abuse and neglect and what that does to kids. And I'd like to see us integrate more this notion of separation trauma that these kids are attempting to cope with. So that is going to be the focus that I am dealing with here, is separation trauma. And I have come up with about 10 or 12 characteristics I have noticed with these kids as they are coping with this, as they attempt to heal and to recover. It's absolutely amazing to me, these kids, and how they're able to do it. I've been around long enough that some of these kids I started out with when they were 8, 9, and 10, they're in their 20s and 30s, and some of them are making it, some of them aren't, but nonetheless they're amazingly resilient with a tremendous amount of resources. In addition to the separation trauma that these kids are contending with, it is what Ivan Naj refers to as split loyalties. And to me, this is I like those familiar nods. Somebody's heard this stuff too, that's great. But this notion of split loyalties is a very complex one for these kids. What it means is we are setting up conditions to impose tremendous psychological burdens on these kids, that they're loyal, they can't win. they're in a constant double bind, and that creates dysfunctional behavior. And I think those of us that are part of the system need to take responsibility for putting these kids in a position of split loyalties between the adoptive family and the birth family. What we do, we place these kids in adoptive families, and we say to them, attach to this adoptive family. Forget about your birth parents who abused you and neglected you until you're 18 or on your own. That doesn't work. That's crazy making. These kids carry a tremendous sense of rejection. They carry a tremendous sense of blame. It's like, we all know, those of us that do marital therapy, that they say it takes 3 to 5 years to heal from a divorce, right? And don't think about a serious relationship until you're well healed. My gosh, what are we asking these kids to do? You know, we're asking them to come from a trail of broken family relationships and attach to an adoptive family. I mean, that's asking so much of these kids. So I think as part of the system, we really need to think about it. I don't begin to have all of the answers, but again, this is the arena where we can raise these questions and dialogue and try to take a look at what's happening for these kids, and consequently for the adoptive families, consequently for their birth families. I used to work in Montana, and I did a lot of work on the reservations, and I took these kids on what I called route searches. And my husband used to get very worried because I'd be out in these nooks and crannies, you know, he'd worry about my safety and whatnot. But I was committed to finding these birth parents. It was real clear to me that these kids weren't going to heal until we did some kind of work incorporating them, no matter what the degree of abuse or whatever that went on. You know, that we had to do something. That was the missing link in healing and working with these kids. I was working with one youngster, and she was 16 at the time, and I'd worked with her for a year. And she was just beginning to, well, I can't really say trust me, but she was beginning to open up more, because trust is such an issue with these kids. She began telling me, you know, she was a very depressed young woman. And she said, you know, Suzanne, I was the one that made that phone call when I was 5. The phone call because my mom hadn't been around for 3 days, and my little brother and I hadn't eaten. And the police came, and I never saw my mother again. You know, that kid blamed herself. She carried that with her all of these years. So these are the pieces we need to be aware of. We need to somehow find ways to incorporate the birth parents in whatever planning. If not physically, sometimes that just isn't possible, it isn't safe, but some way, somehow, to incorporate them more as we work with these kids. And I'd love to see that more in the practice arena and more discussion. If we don't do that, and those of you that are adoptive parents, and Helen, you know, I think that this was part of her dynamics, even with her children adopted as infants. They project onto the adoptive parent the pain and the agony from the previous separation trauma from the birth parent. And I see nods, so I know that many of you have experienced that. So unless we address that, we're going to see more and more of this projection, and it's painful for everyone. What I'm attempting to do also in talking about separation trauma is to normalize this, so that those of you who are engaged in this process know that you're not crazy, the kids aren't, but you're all coping in a normal way with very abnormal conditions. It's like many of the fabulous contributors here talk about the stages of adoption and normalizing that. And I'm trying to do that for the older adoptee, that there are certain characteristics that I see beginning to emerge. So what are some of these characteristics that I'm beginning to see with these kids? The first is that recovery is very slow. Slow, slow, slow. I've been working with some families that have had these kids for 5, 6, 7 years. And the kid, you know, there's still the distance. The kid is still struggling. The family's still struggling. That's just a reflection of how deep the wound is. It's a primal wound. And I think Helen's, you know, very touching story today about, you know, her kids even adopted as infants and the separation trauma that they were manifesting in her family. You know, if Helen knew that back then, how it could have relieved them. You know, they would have said, okay, we're going through the pain, we're going through the grief, this is okay. You know, but that wasn't known back then. But for these kids, it perhaps is an even deeper wound because they had time with that birth parent. They went through the good times, they went through the bad times. So it truly is a very, very slow recovery process.
This is the end of side A. Please turn your tape over and continue on side B.
Now, these kids, they're kids of paradox. On the one hand, they say, love me, but on the other hand say, I am so frightened of love, and they push us away. They say that they're desperate for affection, but on the other hand, they can set themselves up so that you really don't like them. You know, and I've seen this as a real struggle for adoptive parents who absolutely adore kids, finding themselves thinking the most mean, rotten, awful things about these kids. You know, it can be a real complicated dynamic. These kids in that regard can manipulate their own destruction. So they truly are kids of paradox. They're kids of rage. And it's a rage that sometimes is mighty direct. It's right out there. You know, I've seen a lot of homes have a lot of physical destruction. But they're also kids that internalize the rage. I've seen a lot of depressed kids. I've seen a lot of hostile kids. It's masked in many kinds of ways. I've seen it be passive-aggressive, where they set others up in terms of, you know, acting out their anger, or they're very indirect with their anger. I remember, well, I better not get into storytelling, I'll get really sidetracked, but it can become very creative in terms of how they do manifest it. Another basic one is these kids are self-parenters. They learned, and related to that is that they can't trust. They learned early on, it's not safe for me to count on an adult, therefore I'm going to be parenting myself. This is so hard for the parents, and especially if it's a sibling group. You could have, you know, an older kid still wanting to take care of the sibs and not replace that parenting function. This is where it gets especially hard in the teenage years, because this area leads to control battles that you did. I'm sure some of you have experienced these control battles. So we have some handouts in there that address creative ways to deal with the control, because tremendous pain can arise from this area if you try to lock heads logically during this process, because you're trying to deal logically with powerfully emotional feelings, and you know, the two do not mix here. Another characteristic I find with these kids, they numb out. They have experienced so much pain that in order to psychologically survive, they had to shield themselves from feeling. This is an area I would love to see a lot of clinical work addressed toward, because I think these kids in this process, particularly with therapists who are not familiar with adoption dynamics, who are not familiar with separation trauma, mislabel these kids as psychopaths, or mislabel these kids as narcissistic personality disorders. You know, they're numbing out because of the separation trauma. Let's look at this. Let's find ways to deal with the separation trauma. Let's not just label them and, you know, and not carry it further. This numbing out process as parents, especially for teens, this can be very hard for you because discipline often is not effective with these kids. I mean, I have families coming to me a lot, you know, with this area. You know, what can we do? How can we change this? And I haven't come up with any magic answer. Any of you have, I would love to hear from you. It's very hard because these kids do numb out. Another characteristic with these kids, many of them engage in lying, they engage in stealing, they engage in inappropriate sexual acting out behavior, other forms of self-destruction. And think of your own homes, your own friends, your own clinical work, the energy that goes into addressing the lying, the stealing. Everything is focused on that, right? I mean, it's just so exhausting for everybody. For these kids, these behaviors are highly addicting. They're highly addicting because they avoid the real pain. They don't have to do the grief work. They don't have to face the rage. They don't have to face the pain of losing the birth parent. I mean, they're great avoidance behaviors. I get hooked on this right and left. Every once in a while the light goes off and I go say to myself, okay, Suze, you're going down the wrong path here. you know, and so I get back on the right path and help them do the healing pain kind of work. But the lying, the stealing are very addicting, very, very reinforcing behaviors. Hard on parents, very hard. These kids exhibit the destructive entitlement Carol talked about from Naja's work, that in a sense, and this is that they are entitled to act destructively as they balance the justice. You know, until that scale is balanced. On our bibliography, we do have Naja's book reference, and I really encourage the clinicians to check his work out. It's just been the most helpful approach for me in terms of family systems and as it fits adoption. It's just very, very helpful. These kids have very high anxiety, constant anxiety. Therefore, they misperceive reality frequently. This morning, I think it was Annette in her opening talk was referring to sharpening focus in the glasses metaphor. And these kids do look at life, do look at situations with a different set of glasses than you and I. And they perceive threat when there isn't any. They're just hyper alert, okay? And this is because they're preoccupied with self-protection. You know, I have one family in therapy, and it's great. They've been in there over a year now, and the healing really is taking on momentum. But the 16-year-old girl, for the longest time, all she would do, she would just look at the mother, and the slightest, you know, change in facial gesture of the mother, she was convinced that she was in trouble or the mother was angry at her. You know, the mother was just getting so exasperated. You know, but that comes from a place of self-protection. When you tell them that, when you normalize that, takes a little bit of the heat off, takes a little bit of the energy off. These kids, they can often show a victim side, okay, and this is reflective again of abuse dynamics, but that's something to watch for with these kids. A unique concept, and this is what I want to call their attempts to connect. I think there is a misnomer about these kids in that they don't make any attempt to connect at all, because they do. They do make attempts to attach. It's in usually negative ways, but that's what they are trying to do. This is a handout, the protective bonding cycle. And again, we do have a list up here. I guess we ran short. We didn't anticipate this many in here, so if you want the handouts, to sign up here at the end. But this protective bonding cycle describes how in a negative way these kids attempt to reach out. And the tragic part, when they reach out in a negative way, either as clinicians or parents, we can really get turned off and get angry and frustrated, so that blocks their attempt to connect. But to me, the encouragement that is offered by this little diagram here is that since we're the adults here, we have an opportunity to change what we're doing. If we can learn to read that the kids are really trying to make a negative attempt to connect, that we can make some changes and therefore promote the bits of attachment that are needed. They're kids caught in grief. We need to be aware of that. And there's been so many of the presenters talking about the grief work in this process. But these are kids in the grief process, and we need to pay attention to that. I'm getting aware of the clock here, so I can turn this over. So those are some of the characteristics that I've noticed through the years about these kids. And their survival, their coping skills. And when you think of how these kids have survived, it's rather amazing. What does this mean for us as parents? What does this mean for us as therapists? I think one of the things is to pay close attention to ourselves as we work with these youngsters. We can often feel used and abused. You know, and what can we do with, to take care of ourselves at this time? With these kids, they can draw out our dark side. And so our self-esteem can often be on the line. I mean, we find ourselves thinking and doing things that do not fit with the concept of the kind of person we want to be. So this is something we need to work on. We need to take ownership of in engaging with these kind of kids. Because of this, it is easy to engage in control battles with these kids, and we have to watch for that. It's essential for us to work on our own personal issues. You know, what's my garbage that I need to take care of? Because if we don't, they're going to find it. I mean, I would love to have a researcher do a pretty good objective study. It amazes me how these kids find our Achilles heels. I mean, I'm sure some of you have found that. Whatever it is, they're going to find it. So we need to be doing that personal work. We need to really work to have controlled, this wonderful social work term, controlled emotional involvement with these kids. To get too angry is going to scare them off. You know, to come on too close is going to scare them off. You know, we really need to be careful and to honor their boundaries and what they're capable of, what they're not capable of. If we pull away too far, that's going to panic them. That abandonment issue is going to surface for them. So we really do need to work for that balance, that controlled emotional involvement. The other piece with these kids that is more important than a lot of other parenting styles, the structure and the consistency are essential. The smaller the box you give these kids to operate in, the better. They need the structure, they need the control, because internally they're so out of control. And this becomes tricky because of that numbing out process that I talked about earlier and how they fight control. So it's not easy all the way around. But I think we're finding more answers, and I hope through dialogue we can learn even more. So at this point, I think we'd like to turn this over to questions, or if Helen or Carol have any more to add. Either of you?
Why don't we address the question?
I'm curious about this numbing out process that you speak of. I work in a residential treatment facility for teenage girls, and most of them are victims of abuse and neglect, and some of them have no family to return to. And they're not adopted, but they're certainly of the category of the type of child who I think is often placed in the older child adoption. And in one particular girl that I'm thinking of really tends to shut down totally. And it feels like there's no means of penetrating that from my position as a therapist or from the child care workers' positions as well. And, you know, ultimately you end up with a lot of the frustration and the control battles and increased acting out. I'm wondering if you could speak to that a little bit.
Now, this is a youngster who is not adopted.
Right. She's a ward of the court, but she's not adopted. Her mother died and her father's basically abandoned her.
Say that again.
Her mother died and her father has abandoned her.
Oh, so what work have you done around the abandonment? Has there?
Well,
Jeff, well, this take, but that, to me, when you said that, you know, that to me the numbing out often comes around the grief. Well, I mean the other pain, but the grief work, it especially they numb out around that. And it sounds like that there's a tremendous amount of unresolved grief work if there's been both the abandonment and the death of a parent. That the separation trauma issues are very pertinent for her. Has there been a ritual for her grief work? A ritual for the death of her mother? I don't know what the circumstances of the mother's death was, but I've had good luck with that. Not all the time, but it's one thing that has worked, where you create some kind of a ritual for her to say goodbye, be it a spiritual one. I'm not sure how it would be, but the two of you could plan that together. That's something that occurs to me. But it sounds like grief work. Any other? Yeah.
Yeah, one of the things that I think you're doing that really fits, and you might want to look at some more adoption stuff, just because of the behaviors we get in adoption situations, there's lots of kids that were never adopted,
right.
but went through some of the same issues as if they had been adopted.
That's right.
And the dual identity, I don't know what that particular situation is, but the whole issue of dual identity, and maybe she was really good in their eyes part of the time and really bad in their eyes part of the time, and so she grew up with two identities with the same set of parents. As adoptees, we get to grow up with two identities with two sets of parents. Maybe she didn't get that.
Yeah.
And so just who is she may be at risk for her.
I also think you have to be respectful of teens and a sense of time. Time. When I think of adult time and when I think of teenage time, they're two different, 15 minutes to an adult and 15 minutes to a teen that's numbed out is probably 2 hours. So keep the session short and give her the space to come and go so she has some control. and also, reinforce from a developmental cycle that you trust her own rate of speed and her own
That's
growth
nice.
process. That there's seasons, there's winter and spring and fall. I use lots of metaphors in terms of talking to teens. And she's probably at the numbing stage in the grief cycle, and she'll probably find times that she may feel she's angry or she's depressed. So you're preparing her for feelings that may surface, and there's a context for her to have those feelings in, because she's probably going to be scared by the intensity of her emotions.
That's right. The other thought quickly that occurs there too, it's that notion of planting seeds, that what you're saying, might not be seeming to have an impact now, but down the road. That helps me a lot when you're,
You're stuck.
yeah.
Yes?
I've been working with a family where the child, the boy, the oldest boy is going on 11. And they've seen numerous therapists, and the last one is a psychiatrist who diagnosed him as sociopathic personality disorder.
At how old?
Which is, I've learned, a common diagnosis for adoptees. And I looked into it since then. He also, the doctor sent the family home, the parents, with a book on sociopathic disorder.
Great.
Relating it to, not that he's necessarily sociopathic as much as to help them understand unconnectedness. So I've been doing some research since then, and somebody told me something about the DSM-4 has absolutely nothing in it to do with adoption issues.
Right, that's
And
correct.
I've looked into somebody Adoptive Fine.
Oh, yes.
Right.
They're really interested in that and how that could enter into it more, because I'm just sort of getting new into working with families with adoption. And I have this people now, and the parents are about to give them up. They're saying in front of them, I wish I'd never done this. And he's acting out more and more.
You can't blame him for acting out.
And I feel really flat and stuck
Ken,
as
did,
far as therapist.
oh, great, great. Yes, sir. Oops.
I think all teenagers need grandmothers because they don't have, the mother is supplying the discipline, or the father. They're being castigated because they wear crazy clothes. All sorts of the things that parents have to discipline their children. A grandmother can just be fun and play, and I think it's a release. And I think lots of teenagers will confess things to a grandmother that they wouldn't to their parents. I mean, that's the function of a grandmother, and I think that it doesn't necessarily have to be a grandmother. It could be somebody outside the family, somebody who's fun. I mean, I think teenagers are so disturbed they need to have fun. Somebody will play games with them. It's all so serious.
It's a good point.
And I don't know.
Good.
But parents can do it and also say, you can't wear that to school, or it's too suggestive, or you can't do that. But as a grandmother, you can sort of laugh about it and say you used to do that too, and which you can expose yourself as a grandmother, whereas a parent can't expose herself.
See, I think what teenagers need is an extended family system.
That's your point.
So whether it's the Israeli system of having teens be in a kibbutz, I think we need to have resources outside the family so parents have time out or kids have time out, but they still know who that family is. And I think somewhere in the evolution of the American family in the last 20, 30 years, I think the developmental stages of adolescence is new, and the lifestyles haven't quite caught up with all the changes. I think kids grow up earlier and they stay teenagers till they're 25. So I think that our way of thinking about adolescence and early, middle, and late stages are going to need to think about teenagers. We're going to need to think about creating extended family systems. We're going to need to use tough love, families to exchange kids. I think we're on the And I think adopted teens and other teens are letting us know that the American family system isn't working and we're going to need alternatives.
Yes, I was very interested to hear you say that a 15-minute session was about all you or the child could take. And I was wondering, have you thought about being with that child for 24 hours a day and how you might get stressed out? And what can be done to help the adoptive parent to survive? And how can they be supported, because they are the ones who really have the most contact with that child and are responsible for their actions. They have to put the pieces together after something takes place, or the child
Good question.
causes something to take place. And I think a real good idea, maybe you want to encourage some study on these. Give the adoptive parents a little respite,
Yes.
maybe,
Yes.
and have a place
Yes.
where the teenagers can go for a while and the therapist can take care of them.
Oh, yeah, excellent,
24 hours a day.
excellent point.
Day off.
See, if a teenager wasn't adopted and a parent needed time out, it would not be a big deal. Because it's quoted an adopted teen, there isn't the same kind of permission to take care of yourself in the same way.
You could take a nap on Sunday afternoon.
Like
I don't think it's
everybody.
just that you don't have the permission. I think that there's a greater fear on the part of the child that you're not being, that you don't care when you do that with adopted kids. And, I mean, when first of all, I wanted to say something else. Oh, one of the things she was asking about talking to the child and how can you get through these young kids. Sometimes talking to them on the telephone is much more effective because they don't have to fear the connection so much. You have enough distance there where they can allow themselves to talk to you and
That's a
be
good point.
more connected in a real way because they protected themselves from getting too close. Because getting
That's
too
nice.
close, as you say, connected is dangerous to them.
That's right.
You know, they found out that that doesn't last. They can't trust it. So why are they going to put themselves in that position again?
That's right.
May I interject something here too? Basically, there are, quote, two kinds of adoptees. Whether you're aware or not, there's, quote, the bad and the good. The bad are the one, and I had one on either end of mine, were the kind that felt the rejection and the, quote, separation so deeply that they pushed constantly. I've been rejected once. Are you going to reject me? The two in the middle were basically really wanted to know, but they would never make any waves. And they were, quote, always a good adoptee, always trying to be the perfect child kind of thing. And I think all of this, comes into play and into the, as I say, there's the good and the bad.
Yeah. This is so hard. There's so many. It's great.
There's a couple of things. One, I think in dealing with adopted teens, if the adoption issues haven't been dealt with, it's even more difficult.
Oh, that's right.
The North American Council on Adoptable Children developed a program for pre-teen counseling to get some of the adoption issues, both for parents and for the kids, opened up and dealt with.
That's
And
great.
they have information on that if you want to contact them for that, because it really does make it more difficult if, while they're going through adolescence, it's the first time they've really dealt with their
Right.
adoption issues.
Is this a
Statistically,
group? Is this
It's a group out of Minneapolis, right, a major national organization.
I'm a regional advisory committee member to that product.
Okay, I was one of the testing
Yeah,
program
and if anybody has any questions, I'd be happy to answer. They're developing one for adolescents right now too, so.
Oh, excellent.
It's
Definitely.
implemented now. It's going to be a nationwide kind of thing. It's an excellent product.
Is this for the older adoptee? Or any?
Designed for kids that were terminated rights.
Okay.
And they redid it to include infant adoptions as well.
Great.
Do you want to add anything from what you found doing that work?
Well, I can say it's a good product because I'm just an advisory member. I'm not the one who produced it. 3 people out of the Children's Home Society of Minnesota have contracted with NACAC to produce the tool. And it's designed as a preventative educational tool for kids and parents. And it's a product that meets over 8 sessions, and it uses a lot of Watson's stuff from his new product that you and Bergeron developed. And it breaks it down into 8 stages. The groups meet for a period of 8 weeks. And the kids meet simultaneously while the adults are meeting. It's kind of an educational thing. And they're talking about everything we're talking about here, so everybody becomes aware of issues. And they use members of the triad and professionals to conduct both sessions with kids and adults.
What's the ages?
Well, for the kids, it's...
The original was 7 to 11.
Oh, yeah.
And it was adjusted according to the content of the group.
How do we get this?
You can contact Joe Kroll. He's the president of NACAC in St. Paul, Minnesota. You just write Joe Kroll, president, North American Council on Adoptable Children, St. Paul, Minnesota. It'll get to him.
Oh, that just sounds marvelous.
Yes, it's called Adoption the Second Time Around.
So I was very much taken by this woman over here, the parent, in the gray corduroy jacket there. And I think that relates to that, because much of my work has been with the adoptive parents with these kids, and it is so exhausting, and it gets so frightening, and you see the kids needing so much, but yet you can become so depleted because the issues are so complex and just so ongoing. So I'm very glad you raised that issue.
While I'm tooting other people's horns, I'd like to toot one other organization's horn, and that's an organization also in Minneapolis called RAP, Resources for Adoptive Parenting. And what they've discovered is what a lot of people have discovered, is that sometimes because of the family system stuff and because of the way we all get stuck in our own problems, that when adoptive parents get together and start commiserating, they say, well, I can handle your kid. And so they're doing respite care. But what they're doing is they're taking each other's kids for the weekend. And somehow that gives them life, that gives them breath, and it gives the kids a break, and it's kind of a fun thing that's producing some
marvelous.
life. And so it's a new tool that's been developed.
That's great. Ken?
In terms of respite, there was a study done in Illinois. They sent a survey to every family that had an adopted special needs child and was getting an adoption supplement, a subsidy. That was a broad sample. They got a remarkably good response, and the questions on the survey, this has also been published, available through State Department of Children and Family Services, but the adopted parents were asked to respond what was the greatest need they had and list them, and then what resources had they used the most and list them, so that the purpose was to try to help the community, the state, the professionals begin to see what the resources were. And we assumed that respite care was going to be highest on the list. The number one item on the list, 44% of the people of the adoptive parents said help with school. That's the school thing. And that's an interesting thing. If you think about it, so many families are dealing not only with the normal adolescent problems and the adoptive adolescent problem, but with the school is constantly threatening to expel or suspend or throw your child out. And I think it just points a direction that we might, as a group of concerned people, begin to think about. Our school systems don't work well for most kids. They work even less well for adolescents. And just as and for adopted adolescents, just as for the young lady back here, the easy solution is to push the child out, you know.
Yeah.
And of course, for an adopted child, that has all sorts of ramifications in terms of the rejection issues.
You wanted to say something in the back?
Yeah, I've run a school program in an in-house treatment center for 4 years where we don't even mention adoption. And as I said in the other meeting, I feel it's probably the core issue, but it sort of accidentally slips through the cracks. Now, what I'm wondering are there any legal problems with inserting adoptions in information in the questionnaire when the person is a minor and the parents, adoptive parents or the state, say that they're not to disclose anything about the adoptive parents or that they're adopted?
I'm not sure. Can anyone answer that? Yes.
I'm not sure I can answer it, but we developed a program at Northridge Hospital Medical Center. There's someone here from that program with me, and we have developed a track for these families. And these families are more or less labeled, if you will, when they come in. I hate to use that word, but they're identified when they come into the track, into the hospital, and they are automatically sent on through this program. I'm going to be talking more about this at a workshop on Saturday, and they actually have didactic training, process groups as families, as adoptees, as parents, and they're certainly identified. The parents choose to say whether their children are adopted or not. What I have found in many situations is that a lot of parents choose not to tell the schools or other people that their children are adopted when those facilities could be helpful to them, because they don't want to be different, quote unquote.
Are you asking whether or not you can ask that on your intake?
That's one question. The other thing is, yeah, ask it if they have specifically requested that adoption not be mentioned to the child. If the child doesn't know he or she
Very
is
few
adopted,
days, very few children don't know.
Oh my gosh.
I have quite a few that don't know.
I'm not surprised. I'm not surprised. Yeah, that's why they're there. They already know. But you certainly can ask it on your intake. You can ask whatever you want to on your intake. That's your legal prerogative. Whether or not you can tell them. I mean, I would say that would be a clinical issue with even your own clinic, and I would suggest that you probably need to in some way, because otherwise you're part of the same system that's failing to validate the children's feeling that there is some secret.
I agree completely.
Although there may be a need to incorporate it working with the parents to deal with why do they not want that dealt with, so that the parents are supporting you in revealing that to the kids. One of the issues that ties to school that some of you may be unaware of, adoptees are diagnosed 8 times as frequently as having ADHD. And you spoke earlier about being hyper aware. My term is radar, hypervigilance.
Yes, yes.
It is an adaptive behavior. If I'm fearful about what's happening in my world, I'm paying attention to everything that's going on. And I may not be focusing on the blackboard, which the teacher wants me to.
That's right.
And if you look at what schools do to deal with ADHD, more often than not, they make it more difficult for me to see what's going on to make sure I'm safe, rather than less difficult.
They send you out of the room, they reject you, they abandon you.
Or
The
they
abandonment.
go up to the front by the teacher, where there's all these things going on behind me, and I need to know what's going on, so I'm going to be turning around to look.
It's anxiety.
And there is a general ignorance, at least in Colorado Springs, on the part of the educational system, about that as an adoption issue.
Do any of, oh, excuse me.
I'm frustrated by that.
Oh, that's, Lois Molina, in her publication, do any of you get that, The Adopted Child? And last September, she had just an excellent article on the schools and sensitizing them. So that's a resource you might want to check into, is her publication, Lois Molina and The Adopted Child. Connie, yeah.
One of my clients right now, an 11-year-old, was placed in the state of Oregon in a program that specialized in working with ADD, because he's not really too hyperactive, but he's certainly ADD. And but they're not addressing his adoption issues at all. And his adoptive parents were so disappointed by how they didn't feel that the treatment agency was addressing that issue. And then that raises an issue for me too, is that where do you send the kids so you can identify that? So who is going to treat that kid and that family? And, you know, that is, I think, the biggest frustration, at least in our community, that there just are not people around who know enough about adopting stuff to be able to do well with a family that needs help.
That's right.
Brainstorm. I just had a brainstorm.
Oh, great.
Next year's conference, why don't we invite some educators to present material? More to educate them than to have them educate us. I mean, we could find a couple of people in Philadelphia who specialize in working with special needs children or something, put them on the program, and then go to work on them.
See, I would like to share our experience from Eugene, Oregon, which I think of as this typical community. And we used to think that the attorneys were the last bastion. And much to our surprise, we got invited to, we tried the traditional route to talk to the attorneys, and we got stonewalled. And then I talked to a friend who happens to be an attorney who said, "Oh, I'm on that committee, I'll invite you." You know, and that personal entree, we spoke to family practice attorneys, and then we got invited to the women attorneys of Lane County. So what I want to encourage people to do is not to assume whether it's educators, attorneys, OBGYNs are inaccessible. Because, you know, I don't think our community is any different, and with a little bit of personal
relationship building,
you know, a little bit goes a long way, and people are real responsive to the new terminology. They're real receptive to being educated. You know, we always find out after each time we talk, we have to be, you know, that there are adoptees in the audience, that we can't just assume that we're talking to adoptive, to professionals, because there's adoptive parents as well. And that I want to encourage more and more of you to reach out within your own communities and educate.
We did that with the school counselors. In mine, you know, it'd be a good time now perhaps to do that, to make contacts with them for their in-service training in the fall. And we were able to do that last year, and we had a panel of, were you on that panel? There was other adoptive parents, and Carol and I and a few other people, and the counselors were very receptive. So it is that reaching out and that relationship building, and they are ready to hear. Some of them are ready to hear, so it really is worth the effort.
We regularly train probation officers, and now they've actually added it to their intake sheet in Contra Costa County in Northern California to ask about adoption. And I think it's been very helpful, because those children are then getting referrals to therapists who do have some expertise.
That's great.
Will somebody send me an intake sheet?
That's great.
I ask on my intake sheet, I ask, how many children have you had? I learned that from Sharon Kaplan. And I also ask, you know, are they stepchildren, adopted children, birth children? You know, because it's another level, and what have been the losses in your life? You know, so it's from the get-go, what are the issues?
Yeah, and you give them a choice. You don't just, there isn't just a specific question as to are you adopted, but you know, what are, you give them a choice of.
How often does it happen that a special needs child or a child that has some type of problem like that was not presented as such when the child was adopted?
That's right. That's right.
This was a complete surprise. 3 months down the line.
Yeah.
That's right.
That would be a very good question.
I think that's the change in the adoptive community, what we know now versus what we knew then.
Although there's been, I'm a Colorado intermediary, and I'm going now and reading the files that were written in the 30s, the 40s, the 50s. And there was some blatant lying by social workers.
I wrote them.
Records were closed. There was no accountability. And
Whatever the social worker decided to put down, she put down.
And there was no, and some of them were hymns, interestingly enough. And when you go to do the search, it's real interesting, because here you have this so-called factual information that has more to do with their science fiction or something about how they wanted to impress that set of adoptive parents. And it's really fascinating to see.
Or
some
just
of
from
those.
lack of asking questions, you know, we're dealing now with a child that came back, now an adult, 33-year-old person, around questions of racial identity. There is nothing factually that identifies this child's racial background. There is a line in the record by a worker, she looks like she's probably Eurasian. And that was somehow passed on to the adoptive parents. You know, what does that mean? And in somebody's assessment in terms of the child's appearance, and this child, adult now is struggling with their parenting and so forth, issues that were made by the social worker's casual comment, if you will.
Well, I have one right now that is institutionalized, diagnosed as a sociopath, who is probably half black, and her parents were told that the birth parents were white college students. Every picture of the child indicates that probably she's half black, but her family has been in total denial about that issue. And sure enough, she needs care. Gee, I wonder why.
Yeah.
We're doing better. We're doing better.
And, yes, one more here.
Yeah, well, my question is more about the adoptee who was adopted at birth. I work with a lot of children like that, and I see the syndrome of the parents not able to let the children leave home, where they make these children into babies. And I was wondering if you had any suggestions. And lots of them use adoption as the excuse for why the children has special problems. The child has special problems, and therefore needs to be in the family longer and taken care of longer, and is kind of, I mean, it's kind of lame. That's
The adoptive parents feel threatened. They feel very threatened that they're going to, quote, lose that child.
and I'm just wondering how to reframe that, or how to use it
That's
positively.
why I use the example about where is the family developmentally. Because if adolescents grow up, the next stage in family development is where is the couple? You know, so when couples have to go back to being a couple, they're going back to the time in their life where the family was formed, and are their emotional needs being met from each other, or are they using their kids to meet their emotional needs? And the same way that Suzanne talked about kids knowing, you know, a therapist unresolved issues, kids have that radar to know that the parents might not make it. You know, if they're not there to take care of mom or dad, you know, they stay a little longer. Usually if there's unresolved infertility issues, there's more of a tendency to keep kids little. You know, because if kids grow up, then they leave home. So which of the two parents is not giving them messages to succeed? You know, I would like to see more work done with dads. You know, with fathers who have infertility issues, moms are more used to dealing with emotions and feelings and have more of a sense that infertility is a lifelong issue that needs to keep being resolved. I think men stonewall it. And on an unconscious level in family development, they don't step in and help their children leave. So then that's a theory that, you know, I don't think applies in all cases, but in a lot of situations, it's the marital dyad that hasn't resolved some of their issues that are keeping kids at home. You know, the other thing, the other thing that I think goes on is, I think there's some acting out earlier on with some adoptees that are teenagers, and then they go back and they have to redo what I call the little stuff. You know, and there needs to be some time and permission to do that, and then also get the message, it's time to go. You can come home again, I'll always be here, and it's time to develop your own nest, to have your own.
This concludes this session.